Okay, so we're going to look at how to document a transplant assessment clinic in EPR using the new transplant assessment power form. It should be noted that this replaces the previous Microsoft Word document that we used for documenting transplant assessments, but doesn't replace the need to write a clinic letter. Of course, it does mean that if you've documented everything correctly, such as problems and medications and allergies and so on, they will pull through to your clinic letter when you get to write it. So when we get into the patient record, as we can see here, we go to the specialities tab on the left-hand side and then scroll down to the form launcher. And you can get to the transplant assessment form by selecting the pre-transplant assessment power form from the drop-down menu on the right-hand side. So when we accept that, we're faced with this form, and there are multiple tabs down the left-hand side for documenting the various aspects of a patient's history, and we just have to work through them each in order. You'll notice that if the patient's already got an active referral, which all patients should have by the time they reach an assessment clinic, we will automatically have pre-selected the correct organs for transplant on the first page. Now, the importance of that is it activates these tabs on the left-hand side for things like renal history, diabetes history, and intestinal history, depending on the referral type. So we'll work through the form page by page. You can document where the clinic was and the date of the clinic. If the organs have changed, we can change that here, and that will activate or deactivate the tabs that we can see. We then just click through each of these forms. Now, a lot of this documentation will pre-populate if the patient's already been seen or already has history recorded in Oxford. So, for example, patients referred from the Oxford nephrologists will already have a lot of this renal history filled out. This patient, you can see, it's automatically pulled through dialysis sessions, dialysis access, date of end-stage renal disease, because this has previously been documented on the nephrology tab in specialities view by one of the nephrologists. We can add in any additional bits and pieces like current GFR, native urine output, history of urinary tract infections, and any bladder dysfunction. And each of these tabs has got a box for any additional comments that you wish to place in whilst doing the assessment. Likewise, for patients referred for an SBK or a pancreas alone or an islet transplant, we'll take a full diabetes history, including type of diabetes, date of diagnosis, indication for pancreas transplant, and then various aspects of glucose control, which we would normally be documenting during clinics. And this includes things like hypoglycemic unawareness, current insulin control, hypoglycemia, and so on. There's a section for diabetic complications here, and there's a lot of logic built into here. So patients with neuropathy, gastroparesis, it'll ask us about the type of gastroparesis. Retinopathy, it'll ask us about previous treatments, which side, and so on. And we can fill all that out, and again, there's free text down the bottom. Okay, the intestinal history for this patient is grayed out because the patient's been referred for an SBK transplant and the intestinal history is not relevant. When we get through to the past medical history, you can see we're using the standard diagnosis and problems section from within EPR. The advantage of doing this is that this then will pervades through to any subsequent encounters. Whenever the patient's seen anywhere within the trust, this problem list will be there and up to date. And of course, this problem list can also be pulled through to things like your clinic letters and your discharge summaries. You can see this patient's already got some problems documented, and we can add to that. If you're not completely aware as to the difference between diagnoses and problems. Diagnosis is generally the medical condition that's being treated at this visit, so this clinic, this hospital admissions. It's the acute diagnosis, whereas problems are those things that stay with the patient from one encounter to the next. So, for example, a patient might be admitted to hospital with pneumonia. The diagnosis would be pneumonia. The background problems might be things like asthma or COPD or any other chronic medical problems like diabetes. So for the purposes of the transplant assessment clinic, most of what you're going to be doing is putting the problems in the problem list because they're mainly chronic medical problems. And we can search for those. So when we open those up, most of you will be familiar with this already. But if we want to put, let's say this patient's got hypertension, we can search up hypertension. There'll be thousands of different potential definitions. Scroll down to one you think is appropriate and put it in. If you use certain diagnoses like hypertension, diabetes, and so on very frequently, then there is the option at the bottom of the screen to add it to your favorites. And by adding it to your favorites, you can then pull it out of your favorites rather than having to search each time. When you're putting in a date of diagnosis, there's various different ways you can do it. So you can enter, for example, a date of the diagnosis, and that date can be as simple as just a year, or it can be a month or an exact date, for example, for a procedure. And again, as an alternative, you can enter the patient's age when they were diagnosed. So a patient might tell you, I had it when I was age 34. So you can put that in and it will then calculate the year for you automatically. Okay, once that's in, you click OK. And that will then appear in your problem list. And you just go through that one by one as you would normally for entering your problem list. And there's a little aim memoir at the top of the screen for specific things that we're interested in transplant assessment to make sure you ask about those. Anaesthetic history, this was created in conjunction with our anaesthetic colleagues and captures details like previous general anaesthetics, any previous anaesthetic issues or ITU stays, general functional status, vascular access and any issues with vascular access, use of blood products, and things like dental history. Surgical history. There are two ways of recording surgical history. You can put it in the procedures section in EPR, which is perfectly acceptable. Any previously performed procedures that were saved to the patient's medical history will be included in here. Alternatively, some people prefer to put the procedures in the problem list just because they pull through to clinic letters easier. It doesn't matter where you document them as long as they're documented in either of these sections. There's a section for screening tests and the typical latent TB screening questions. Allergies, again, recorded as they would be normally in EPR. So if the patient's been seen or admitted previously to our trust, the allergies will already be documented and we simply have to click mark as reviewed. Medication history, in very much the same way that we document medication by history in clinics or elsewhere, we do the same here. So this will pull up the medication tab, and then we click on the document by medication history button. History medicine items will appear on the list with a little scroll next to them, which shows that that's a home medication for this patient. It's important to note, particularly for nurses who are filling this in clinic, that this is not a prescription. You are not prescribing medications when you do this. You're simply documenting what a patient normally takes. But the advantage of doing it this way is that this can easily be converted to a prescription when the patient's admitted to a hospital simply by means of by the pharmacist on the ward converting this to a prescription. So in this patient's case, if we click document medication by history, see there's a few medications already documented here. We can add additional ones. It will come up with an error because this is a test patient who's not currently admitted. And you can just search for a drug. So let's say this patient takes paracetamol regularly. It will come up with default dosing options. So say 1 gram 4 times a day for paracetamol. If the patient doesn't know their dose, or if you can't elicit the patient's dose, you can just click the name of the drug. And then when you go back through, You don't have to enter any further details. So you can simply just record that the patient takes paracetamol, don't know the dose. If you do know the dose, you can select the frequent dosing. If a patient doesn't take any medications, you can check the known home medications button at the top, although in a transplant assessment clinic, that's extremely unlikely. Once you've finished, you click document history, and then all of those medications will now be documented. Family history, if there's any significant family history that you want to add to the patient's record, again, we're using the standard Cerner components here. So you just click add. It'll default to showing you father and mother, but you can add additional family members, for example, if you had a brother, and then you can select any medical problem from the problem list here. There'll be some defaults set up for you of common medical problems. If what you want to add does not exist, you can simply click on the little search button in the relevant subject and search again for another medical problem. So let's say we wanted to add seminoma to our list. We can do that. So we double click, adds it onto the list, click down here, and then you can now see on my oncology list, I've got seminoma, and I can just click the little plus button to show that that's now that patient's medical history, and that will come up under a list, which we can see whenever we come back into EPR. Social history, again, the most important ones on here probably are tobacco, alcohol, and employment history. Tobacco history is the standard questions. Have they used in the past? How much do they smoke? Alcohol history is very similar. And then employment, you can put current employment status and their job in. If there's anything else you want to document, of course you can do in terms of nutritional issues and substance misuse if they take any recreational drugs. Final section is the physical history. So if the patient has been weighed this admission, you will get the weight, height, and BMI pulling through automatically. You can add any other observations you like. You can document things like pulses, physical examination in here as you would like. And there's also a free text section for anything additional you want to put in. The final tab is for use by both the doctors and the nurses to document any tests that are required or any further referrals that are required. So if you, for example, want to order all these tests, you can click the column at the top, and that tells the nursing staff or the nurse coordinators that we want these investigations. You can uncheck any that you don't need for a particular patient. When the nurses come to add these, they can then press the requested button and then to show that they've requested them, and then once they're completed and the results have been seen, they can check them. So it's just a way of keeping track of investigations, and the same goes for any additional referrals required, for example the cardiology MDT or a specific anaesthetic assessment. In terms of logistics, generally it'll be the nurse coordinators documenting this, but anybody can do it. The patient willing to be a backup, his transportation required, is there a living donor option, and then the consent information that's been given in clinic, and then just an overall summary comment from whoever's assessing the patient as to whether they're suitable, whether they're high risk, whether there's anything in particular we need to be paying attention to. Once completed, we sign, not save, so the little green tick at the top left hand side, and then that form will now appear in form launch for that patient. Okay. Now, this form is designed to be used by everybody in the MDT assessing the patient. So the transplant coordinator and the surgeon seeing the patient will both use the same form for a given clinic visit. It's very important that only one person has the form open at a time, because if multiple people have the form open at the same time, you may overwrite each other's changes. So the best way to use this is to have the form open with the patient in front of you, and then you know that nobody else will have the form open if you're the one with the patient. And so the way it works in clinic is if the coordinator sees the patient first, they document as much as they can do using the form either in advance of clinic or during the clinic visit, and then the surgeon can come in, have a look, update the form, add any additional information. And so everything only needs to be documented once rather than multiple times. The other big advantage to this is for future clinic appointments, admissions, when the patient's admitted to the ward eventually for transplant. All of that information you've entered will already be there and just needs to be verified rather than entered again. For patients coming for annual reassessments while they're on the waiting list, we should create a new form for each visit. So rather than opening the old form, you would create a new form. However, all of the data from the previous form will automatically pull through to your new form. So if I launch a new form for this patient now, let's say we were going to do an annual reassessment, I've got a pre-transplant assessment form, you can see that all of that history that I've documented previously in here, I didn't fill all of the sections out, but some of these sections, for example, the diabetes history, I started to fill out, and the renal history, all of those sections have pulled through the information from the previous form and just need to be verified rather than repeated, which speeds up your reassessment clinics. So the form, whenever you want to review a patient and review what's been said in pre-transplant assessment, the form can always be accessed under the patient's medical record in the form launcher. And you can always open that form up, click the modify button, and you can always see a copy of that form. The other way that you can see a form is you can see this in summary form. If you go to the Power Notes section on the left-hand side, you'll see there's a summary of that pre-transplant assessment form here, which shows everything that was selected as that was created, including the problem list and everything else that was documented. It's not particularly nice and readable, but again, all of this information, medications, problem list, everything else will pull through to your clinic letters when you create them. And it's as simple as that. So any questions, just let me know.